Measles, a history and resurgence. Measles has been around for centuries, and we have been able to make breakthroughs in medicine to help slow its virality and severity. However, recent trends in the US has led to a resurgence of the disease. The CDC recently reported that measles cases in the US have hit a 33-year high. Only 25 years ago, the disease was considered officially eliminated in the United States, meaning there is no measles spreading within the country, and new cases are only found when someone contracts measles abroad and returns to the country. This year alone has had 1,331 reported cases as of July 2025. But what exactly is causing the resurgence of a disease we almost eradicated from the country? Dr. Adam Ratner, a pediatric infectious disease physician in New York, said of the current problem we're seeing in states like Texas. What we're seeing now is, as vaccine hesitancy has grown, particularly during and after the COVID pandemic, those outbreaks are becoming more frequent and larger. But first, what exactly is measles? Why do we want to protect against it? When measles is first spread, it might take 1 to 2 weeks for symptoms to begin to appear in an infected patient. This includes symptoms like high fever, runny nose, cough, and red watery eyes. 2 to 3 days after first sign symptoms begin, more emblematic measles symptoms begin to appear, like the cough-like spots on the inside of your mouth, or flat red spots near your hairline. 3 to 5 days after, the rash will worsen, often spreading downward, and small raised bumps may appear on top of the affected skin, with the fever possibly spiking up to 104 degrees Fahrenheit. Some minor complications are ear infections and diarrhea, but measles comes with a myriad of severe complications, such as pneumonia, encephalitis, which is swelling of the brain, complications with pregnancy that can lead to premature or underweight babies, and very possibly death. The vast majority of those at risk of dying from this disease are children younger than 5, and anyone who might be at risk for immune system failures past the point of child mortality, which includes most everyone. That is why it's incredibly important for people to vaccinate against the disease, as it helps not only protect ourselves from contracting measles, but also to protect others from spreading it as well. Described as early as the 9th century by a Persian physician, measles has long been a recognized and recorded disease. However, we had a very little understanding of how germs and diseases worked for the majority of human history, so it largely went unchecked. As colonization and exploration increased in the 16th century, the disease became more widespread. As noted by the World Health Organization in their History of Measles Vaccination article, regions of the world without previous exposure to the measles virus were particularly vulnerable. Outbreaks of the virus took devastating effect in isolated communities, such as the Faroe Islands in 1846, Hawaii in 1848, Fiji in 1875, and Rotuma in 1911. Measles remains a worldwide epidemic, but was significantly worse between the 16th and 20th centuries. Medicine advanced, and inoculation and hygiene efforts became more commonplace. Measles cases became less severe, and mortality rates were dropping by the 20th century. In 1954, a boarding school in Boston, Massachusetts experienced a school-wide outbreak of measles, and some nearby doctors from the Boston Children's Hospital took advantage of the opportunity, and they took on the challenge of developing a vaccine for measles. They took throat swabs and blood samples from infected students at the boarding school. An 11-year-old schoolboy named David Edmonston was the sample that led to a successful virus cultivation that enabled doctors to create the first vaccine against measles. John Franklin Enders was the doctor to develop the measles vaccine from the Edmondson B strain, named after David and used as the basis for most live attenuated vaccines to this day. Enders and his team took their vaccine to New York City and Nigeria, testing it on small groups of children from 1958 to 1960. By 1961, trial vaccines for measles were deemed 100% effective, and they were officially licensed for public use 2 years later in 1963. Many individual countries launched vaccination programs at the national level in the 1960s, and the first internationally focused measles immunization programs took place in Africa in 1966. In 1971, Dr. Maurice Hilleman combined the vaccines for measles, mumps, and rubella into the MMR vaccine, and later in 2005, varicella was added to create the MMRV vaccine, a single-shot vaccine that can be taken as early as 9 months old in areas of high risk of contraction. To bring our focus back to the US, we're going to look at a couple of data sets. This first one is the measles cases from the 1985 to 2000, as recorded by the CDC. We had a major outbreak in 1990, leading to 27,808 reported cases. The last year to experience 4-digit case numbers in a single given year in this time period is 1992, with 2,126 cases. Now let's look at a more recent history. It took 27 years for us to break our streak of fewer than four-digit case numbers when we broke the streak in 2019 with 1,274 cases. We did trend down pretty quickly after the outbreak, but unfortunately we broke that record already this year, and it's only August. In 1998, a fraudulent research paper was published in The Lancet, falsely claiming there is a link between the MMR vaccine and autism. It should be noted that the paper lacked any robust evidence supporting this claim, and that the MMR vaccine is suggested to be taken between 12 and 15 months, with a booster shot often taken a year later, which overlaps the earliest time one might begin to see autistic traits develop in their child. Despite the lack of evidence, this paper led to high-income areas dropping in vaccination rates in the following years. In 2010, the lead author of the fraudulent paper was finally charged with misconduct by the British General Medicines Council. The paper was formally retracted, and the lead author was banned from practicing medicine. This paper led to years of misinforming the public on autism in children, as well as incorrect information on what the MMR vaccine does. The study is still cited to fearmonger against vaccines, despite it having been retracted for over 15 years, possibly having contributed to recent trends in dropping vaccination rates in the United States. Health and Human Services Secretary RFK Jr. has publicly dismissed the efficacy of vaccines, even citing the aforementioned redacted study, and most recently canceled $500 million for mRNA vaccine research. Public trust has dramatically decreased regarding medicine and public health, with the COVID-19 pandemic acting as the catalyst for how widespread this distrust goes. Misinformation that spread during COVID-19 has also had a lasting impact, contributing to the distrust around vaccines specifically, and we are still feeling the effects of this today. In order to reach herd immunity in a population, you need to reach a vaccination rate of roughly 95% across your population. As reported by the CDC, 15 years ago, the majority of the US was above or near a 95% vaccination rate for measles. Since then, it has dropped significantly, with many states that once held a 95% vaccination rate barely reaching 90% now. A 5% decrease in immunization might not sound like a lot, but as seen through the uptick in measles cases and the severity of them, it can have a detrimental impact on a population. One recently affected area was North Texas and some of Oklahoma, both states that dropped from 2009 to 2024 in vaccination rates. Vaccines are not a moral issue, nor is it a political one. It is a public health issue, and it should be treated as one. Vaccines have been repeatedly proven to be safe. They significantly increase the likelihood of your survival against deadly diseases like measles. We could protect each other a whole lot more if we choose to take advantage of the tools available to us that have been proven to help protect us.